Hi, it's Dr. Rachel Brown, Medical Director of Prevention and Wellness at Business Health Solutions at Prisma Health. And welcome back to our Business Health COVID and Wellness updates. We missed you over the break. Hope you had a wonderful holiday season and that your new year is getting off to a great start. Certainly is busy for most of us, and I'm going to get right to our update so that you have the answers you need to keep your workforce happy, healthy, and safe. So as you may remember from previous episodes, I always do a little bit of a status report, and sadly the numbers are looking really grim in South Carolina. We are up to a total of 338,112 infections. The overall state percent positive yesterday was 31.8%. So about a third of folks who are getting the test done are actually diagnosed with COVID. For the last 2 weeks, that average has been hovering around 29%. As always, I'll sort of break down a few counties for us. In Greenville, the incidence of COVID positive patients is 1,520 for every 100,000 people in that county. Of course, that puts them in the high risk category. And quite honestly, every county in South Carolina is now in the high risk category. And their average over the last couple of weeks, or excuse me, 1 week percent positive is 39%. Oconee County is seeing about 1,059 cases per 100,000 folks, and their weekly percent positive is 28. Richland County is at 732 folks per 100,000 with a percent positive average of 20.7. And Sumter County is at 780 folks per 100,000 with an average percent positive of 23.8. So we're definitely in the middle of a surge. I think everyone knows that. Hospitals are feeling it. Outpatient facilities are feeling it. You may be seeing this in your workforce and feeling a reduction in numbers because of cases and exposures. So let's talk about the hot topic, and that's the vaccine. As you may or may not know, there are 2 vaccines right now that have been released for use in South Carolina, the Pfizer vaccine and the Moderna vaccine. Very, very similar vaccines. They're both mRNA vaccines. They both require 2 shots. The Pfizer vaccine needs to be stored at ultra cold temperatures, and its second shot is given at around 21 days. The Moderna vaccine can be stored at less cold temperatures, at freezing temperatures, and is given every 28 days. Now, what's important to understand is that while we are tracking the vaccines, and I'm about to show you a website where you can follow this, we have to do this in phases. And so Operation Warp Speed gives recommendations to South Carolina DHEC, which then talks with Prisma Health, and we come up with a plan for how to administer the vaccine in a phased approach. And right now, all across South Carolina, we are in a phase 1A, which means first responders, healthcare workers, long-term facilities are the folks that we're focused on now. But before we get into those details, let me share my screen with you, show you a couple of resources. The first is the vaccine tracker. So if you go to the DHEC website and look at COVID-19 vaccine allocation, first of all, you'll see what phase South Carolina is in, but you'll also see how many total doses of vaccine the state has received. You'll then see a little bit of a lag, but you'll then see data around how many folks have been vaccinated the first and second dose. Keep in mind that this data trails a little behind. It is not accurate each day because of some of the tracking capabilities. But overall, what you can see here is that 41% of all of the doses that have been allocated to South Carolina have been used. Of this 41%, Prisma Health has administered almost a quarter of those doses, 24% of those doses. So again, please visit this website if you're interested to see how this number climbs, how many vaccine doses are we getting, and how well are we getting it out into our community. The next thing I want to show you is Prisma Health's vaccine page. So again, If you go to Prisma Health, coronavirus, and click on COVID-19 vaccine, this is going to give you the most up-to-date information about who is being vaccinated, who is next, and a general timeline. So for instance, you can see here that right now, phase 1 workers only are being vaccinated. You can see that if you feel that like you have phase 1 workers in your organization that you'd like us to help get on the registration list, please email this address here or reach out to us in Business Health directly. I'll show you how to do that in a moment, and we will help you get that information and help you determine whether you truly have 1A employees. If you have 1B employees, we'll go ahead and get this process started and hold it until DHEC announces that we're ready to move into 1B. So let us help you with that process. If you're curious about who's part of 1A, please take a look at this section. You can see again our healthcare workers, our first responders. There are some other clinics that are allowing us to vaccinate their healthcare workers, school nurses, dentists, and even funeral home personnel. If you want to take a look at a general timeline that follows here, please be advised though that things are changing all of the time. So please continue to visit this page for updates, continue to watch our webinars for updates. And finally, if you do want to contact us, you can reach out to us via our go again to Prisma Health Coronavirus and click on creating a safer and healthier workplace. And you will see here, not only do you have access to all of the videos that we'll release each week, but you can reach out to us to either help with vaccine registration, ask us questions about COVID-19 testing and exposure, or get our advice on how to keep your workforce healthy, happy, and safe in other domains. We want to be here for you. So I'm going to stop sharing my screen for just a second so we can talk some more about COVID-19. So there are several other, here we go, I apologize. There are several other vaccines that are in phase 3 trials right now. And if you remember, phase 3 is the last step in terms of investigation before the FDA and its other objective bodies meet to discuss whether a vaccine can be given emergency use authorization and final approval. Just so you have your eyes and ears open, these vaccines are from the AstraZeneca company, Janssen, and Novavax. And there is actually one vaccine in clinical trials right now that is looking at a one-shot dosage. So that could be interesting if that one is approved. So again, we talked about the phase timeline. I showed you who is getting vaccinated now, but let's talk about who will get vaccinated next. So the next phase is 1B, and I think it's important that everyone understand that even within a phase and a tier, there are going to be prioritizations. So the word on the street right now is that technically somewhere around 1 million folks in South Carolina would fall under the 1B classification, and it likely will turn out to be more than that. And so that rollout also has to be done in a prioritized fashion. So keep an eye on these webinars, keep an eye on our website, keep an eye on the DHEC site to find out who's first in 1B. In general, what we're looking at here is folks like firefighters, policemen who might provide emergency care at the scene, for example, and essential workers who are in businesses that are deemed important to continue moving to keep our society going, or who may have conditions where folks tend to have to congregate in groups and are at higher risk for COVID. Among those recommendations, there's also room for folks greater than 75 years of age in phase 1B. So keep an eye out for how that's going to look, who is going to go first. We can tell you that Prisma Health has been deemed the states or the Midlands and the upstates vaccine administrator. So we are going to be working very hard to figure out how we can give you the best access to the vaccine. That certainly will happen on our campuses, but we're also brainstorming right now how we might bring that to you through mobile units through specialized business client vaccine sites in different regions, possibly on-site. And while we're talking about on-site vaccination, let me encourage you to reach out to DHEC and find out more about their closed pod program. POD stands for point of dispensing. And when an organization becomes a closed pod, they work with DHEC and with us to facilitate administering the vaccine to their workforce. Of course, this will be done when it is the appropriate timing and when DHEC determines that it is time to move to 1B and 1C. So it depends on what kind of organization you run. But reach out to them now and start that process now if you are interested in becoming a closed pod. If you do want more information, you're going to want to email mcm@dhec.sc.gov, and they will begin to educate you on what the process looks like and begin the process of certifying and enrolling you if this is something that you're interested in. All right, with the vaccine on the horizon, we're all feeling very, very hopeful. But with this surge, we need to remember that to get through this and to get our hands around this pandemic, we need to continue to be vigilant about our precautions. The vaccine is not a fix-all. It is one big piece of the puzzle in stopping this pandemic. So I encourage you to encourage your workforces to continue socially distancing, to continue wearing masks, continue with good hand hygiene, staying in well-ventilated areas, avoiding gatherings, and even avoiding travel when at all possible. But let's talk about the inevitable. You're going to have employees that still need to be tested. We talked last time about how testing is more common now. We want it to be so we have a better sense of our disease burden. Certainly anyone with symptoms we want to test. We're also doing concomitant flu testing because it is flu season, although a mild one, thankfully. Anyone who's had an exposure to or been a close contact, and remember, a close contact is someone who's been within 6 feet of somebody who's diagnosed with COVID. Doesn't matter if they're wearing a mask, but if they spent more than 15 minutes with them over a 24-hour period, they're considered a close contact and need to quarantine. We're also going to test folks now more who are traveling. And so some recommendations have come out from CDC about international travel. If you do have an employee that has to travel internationally, they recommend testing them 1 to 3 days before they travel and testing them 3 to 5 days after they return. Now let's talk about quarantine. So for folks who travel, they're recommending, international travelers, they're recommending that even though you get that test 3 to 5 days after you return, even if that result is negative, you should still quarantine for 7 days after returning from an international trip. Domestic travel is a little bit different. They recommend the same protocols, testing 1 to 3 days before travel, testing 3 to 5 days after travel, remaining in quarantine for 7 days. But it really has more to do with how much of a risk of exposure someone may have had. So if they attended a social gathering, a wedding, then yes, we want them to quarantine. If they visited a hotel and didn't really have a whole lot of exposure to anybody else, or to many folks, they kept masks on and socially distanced, maybe we're not being as concerned there, and we can have that person return to work. Anyone who returns from any kind of travel or any sort of gathering should be watching for symptoms for 14 days and really just trying to minimize exposure and avoid contact with as many folks as possible. Do you want to talk a little bit more about quarantine? So we mentioned for travelers what we need to do. Obviously, someone who is diagnosed with COVID, the recommendations are the same. They have been for months and months. They isolate for 10 days. They can return to their normal activities in their job after the 10 days if their symptoms are improving and they've not had a fever for at least 24 hours. For exposures, we talked about this a little bit before the holidays, but I want to reiterate, we've got some new procedures and policies and recommendations that are much easier to follow, and therefore hopefully compliance will be higher. But if you do have an employee who's been exposed. There are now 3 strategies for managing quarantine for that person. The first is the same as always, and it is the best. It results in the least risk of spreading an asymptomatic infection. So if someone's been exposed and they can quarantine for 14 days, that's fantastic. There is an option to quarantine for 10 days. Confers about a 1% risk of contagious spread, but that's risk is still pretty darn low. And then finally, there is a strategy where folks can quarantine for 7 days if they get a test on day 5 and the test is negative. This confers about a 5% risk of transmission and spread, but still CDC leaders and scientists feel that this risk is small enough that recommending this 7-day quarantining with a negative test at 5 days, will increase compliance and get folks to really follow these recommendations so that we can stop the spread of COVID-19. So those are my recommendations for you today. To recap, please reach out to us with any questions. Go to the Creating a Safer Workplace page to reach out to us directly. We're available to answer by email, to have one-on-one phone calls. You can also click on the link that will take you to these videos. We're going to do one every week for the next few weeks. Understand that information is changing all of the time. So if you hear something on this in this video that doesn't match with what you've been hearing out in the lay press, please reach out to us for reconciliation. Even between the time this is recorded and posted, there may have been changes, but tune in every week so that you have the most up-to-date information. We hope that you're staying happy, healthy, and safe out there. We're here to care for you so you can care for your workforce.